It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you're doing well today. We have a very, very interesting program lined up for you today. We're going to be talking about a lot of skin health topics. So skincare as it relates to your particular age. And ladies, we are talking to you today. We're going to talk about how to take care of your skin, preserve your skin, keep your skin at its glowing best in your 20s, your 30s, your 40s, your 50s. We're also going to be talking about common causes of allergic rashes here in Florida. You know, in some places it can simply be a plant that you're exposed to or pollution in some areas. What is it here in Florida? We're going to be finding out. But we are going to start today by talking about the new Botox. So you know about Botox, and I am a Botox user myself. Well, so skin tightening and lifting lasers now are said to be the new Botox. You might not need injections anymore. So, gosh, I want to know about something like that. So we are going to go now to an expert. Dr. Manjula Jegasothy is a Harvard and Yale trained aesthetic dermatologist. She's the founder of the Miami Skin Institute, and she joins us now. Hi, Manjula.
Hello, Heidi. Thank you for having me back on your show.
I'm glad that you're here. It's a fun topic and a topic I think so many of us are interested in because we all want to look our best. So later in the program, we'll be talking about how to look our best just from our skincare regimen. But, you know,
Sure.
sometimes you need a little help. Why not? And you know, so there's the new Botox. Tell us about these tightening and lifting lasers.
Sure. This is a paradigm that's kind of shifting amongst aesthetic dermatologists in the last probably 3 to 5 years as these lasers have improved a great deal in terms of their effectiveness. As you said, you've had Botox treatments. Botox fixes fine lines and even deeper lines caused by movement. But there becomes a time when you've kind of maxed out on your Botox. You're getting the regular Botox treatments you've been doing for several years, and you're still not looking like you used to 10 years ago after Botox. So what do you do then? And that's where these lasers come in.
Okay, whoa, but hold on, back it up first.
Okay.
I didn't know
Sure.
you got to a Botox stopping point. What do you mean by that? Tell us.
I think in your mid to late 30s, when you get Botox, your face basically reverts to 10 years ago. You know, it looks smooth, it looks tight, it looks lifted. But what happens as you get older than that, in your 40s and your 50s, there's a elasticity loss. There's a component to your skin that is basically what sagging is, but cannot be addressed by Botox. We tried to address it for a while with fillers, and a lot of people are still thinking that fillers in the cheeks are the way to lift your cheeks. But again, I'm sure we've all seen on TV and other places where people get too much of either Botox or filler because they're really not getting the result they used to get. So this would be the time to turn to one of these lasers.
Okay, so you're saying just the sagging fact alone is not going to be enough to smooth out the wrinkles. Maybe you'll have a smooth area, but you still have some sagging.
You'll have some sagging and some wrinkling just because of this loss of elasticity that neither Botox or fillers can fix.
Yeah, and Botox, for everybody who's not familiar with it, it's a muscle relaxant.
Correct.
Yeah, all right. So let's move on and talk about the lasers. When did you first start using lasers at all for skincare treatment?
I'd say the oldest one in this new generation of lasers is called the Fraxel. It's Fraxel, and it's what's called a fractionated resurfacing, and that's a complicated medical term. But what it means is that it drills thousands of microscopic little holes in the skin that then heal with tightening and smoothing of the skin in that area. So it's nice because it gives you very minimal downtime. You're only red for maybe 24 to 48 hours, and then you'll experience a good 50% smoothing of the skin and a good 20 to 30% tightening of the skin, particularly in some place like the eyelids, when done with even just one treatment.
Okay, so that's the Fraxel. And I've actually observed that. A doctor friend of mine, Dr. John Feza here on the Sun Coast, had invited me in, and I got to watch one of his patients getting it. And afterward, it looked like she kind of had a bad sunburn with a lot of little holes, almost like she'd been run over or something. But then I saw her afterwards. She looked amazing.
I tell people, it's like a very mild road rash, probably for the first few hours after. But by the time you go to bed and get up the next day, you're already a good 70% healed.
So what was it about Fraxel that made everyone keep searching for something else? I mean, is that not great, Fraxel, or is it still being used?
Absolutely. Again, so if people need smoothing of the skin for whatever reason, they have rough spots or they have lines, like I said, that are really etched and Botox and filler aren't getting those lines, anything for any textural smoothing of the skin, Fraxel is ideal. And it's, in fact, the gold standard even now, even though it's been out about 10 years now. So that's for skin smoothing. And if we're saying we're going to these lasers after injectables, that would be the first one I would go to in terms of age chronology. So if somebody in their late 30s, early 40s is a good candidate for Fraxel if they're not completely satisfied with their Botox and or filler results.
Okay, first stop is Fraxel. But what is this, the new one? What are the new lasers?
Okay. So then, about 5 years now, we've had one called Ulthera, and you might have heard of Ultherapy. It's Ultherapy. It's become very popular, and it's on all the TV shows. It's a laser that uses ultrasound waves, very much like a sonogram that you would get when you are pregnant. So you know that it's very safe. And what that laser does is it literally lifts and tightens sagging fat and skin.
Oh, how does it do that?
It shoots a very focused ultrasound beam that then it bypasses the skin, so there's no burning, nothing on the skin itself. You're just mildly red for an hour or so, but it bypasses that and goes to the deep tissue, the ligaments and the muscle fascia underneath the skin, and causes a mild thermal injury there that causes it to contract and causes it to lift.
All right, and what are the results of that as far as how long they last?
So Ulthera is great because it used to be that the first generation, the first edition of that laser was kind of painful and people needed to take some anesthetic, either Valium or oral Percocet or something like that. Now the new edition, I just have patients take Tylenol and they're fine. What that does is it probably achieves about a 40% lifting of the neck and cheeks compared to surgery with basically no downtime.
Wow, 40%. Okay, but what about the smoothing?
The smoothing, no. See, so that's why this would be for the next chronological age in your late 40s, early 50s, when people who were really concerned used to be starting to think about a neck lift. This would be what you did instead now.
Oh, can you use Ulthera on the neck?
Yes, it's good for it's FDA approved for both the neck and, believe it or not, the chest. Not lifting so much the chest, but smoothing out those really deep lines on the décolleté that you really can't get with Botox or filler.
All right. Now, see, when they can invent something that lifts the rest of the chest up, then I think everyone will be millionaires who invents that.
I've been trying to experiment with that, but it's hard because, everybody's still very concerned with doing any laser on the breast area, and so that's a hard one.
Absolutely.
In terms of results, if you get an Ulthera treatment in your 40s, you can expect the results to last about 4 or 5 years. If you get an Ulthera treatment in your 50s, you can expect the results to last about 3 years. And this is one treatment session we're talking about.
Gosh, and how much does something like that cost?
Anywhere between $2,000 and $5,000, and that's why, because the results are so long-lasting, and it's such a better alternative to surgery, and still much less expensive than surgery.
So wait, did you say 2,000 to 5,000? Okay, and that just depends on who you seek out and where you get it done. All right.
Exactly.
Okay, and is there another laser after that, or is it, that's the ultrasound?
Yes, and then this newest generation of lasers just became available. They've been available for a while, but they only became really good in the last 2 years. Ulthera's been around about 5 years. Now this is 2 years. This is the radio frequency lasers. I have what's called a Viora. That's the brand of radio frequency laser that I have. There's also a popular one called Exilis. EXILIS, and essentially they're very good at doing just superficial skin tightening and lifting. So while the Ulthera does the deep tightening and lifting of the fat and subcutaneous tissue, a little bit of muscle, this just does lifting and tightening of the skin. So where the Fraxel smooths that superficial skin, the radio frequency doesn't smooth it, but it tightens it and lifts it.
So that would take the place of what?
That would basically, so let's say your eyelids are sagging, and in the past you used to get your eyebrows lifted a little bit with Botox, but that's no longer doing the trick. Then this would be the perfect thing to do to lift your eyelids.
All right,
Tighten
very interesting. And what about the results of this? How long do these last?
This laser is considerably less expensive. It's on the order of $400 to $600 a treatment per area. And I tell people it's a maintenance thing like Botox, but you don't have to do it as often as Botox. If you're in your 40s, you probably need to do it once a year. If you're in your 50s, probably twice a year.
Very interesting. Okay, and does it work immediately, or Botox takes a few days or even a week or two to kick in? How about these?
All of these. The Fraxel probably is the shortest. It probably takes a week to start seeing results. With Ulthera, it takes a good month before you start seeing results, and the full results take about 6 months. That's why it lasts so long, we think. And then with the Viora, or the radio frequency lasers, generally you see results in the 1 to 2 month time period.
That seems so long. I mean, I guess we're all used to this instant gratification, but what is it physiologically that makes it take so long before you see the results?
We're waiting for collagen production in all of these situations. So the Fraxel probably causes collagen production the most quickly because it's superficial collagen, but all these others are causing deep collagen production, which takes a longer period of time.
That sounds like a movie, Waiting for Collagen Production. the middle-aged story. All right, so what about complications, though? There have to be some risks involved, and maybe not everyone is a candidate. Tell us about that.
Sure. With Fraxel, definitely you should not get any sun exposure for 1 week before and a week to 2 weeks after, depending on how dark your skin is. Also with Fraxel, you should definitely go to somebody who is a board-certified aesthetic physician, because a lot of these medi-spas and places are doing it on darker skin patients and burning them. So it's very important, if you're darker skinned, to go to somebody who is trained properly to treat lasers with darker skin. With the Ulthera, occasionally, if the procedure is not done correctly, you can get some mild superficial burns of the skin, which actually peel off and go away within a few days. So there's no real downside to Ulthera, except some people think it works less well than others. Everybody's a little bit different, and when you're spending more than $2,000, some people are expecting a miracle, and that doesn't always happen.
Sure.
So that's probably the biggest downside with Ulthera. And then with the radio frequency, sort of similar to the Fraxel, you have to go to somebody who knows what they're doing in terms of skin healing. And so darker skin patients we need to be aware, use the proper settings, don't use settings that are too high, and definitely don't get sun for 1 week before and 1 week after, because the only other, just like Fraxel, you could get a superficial burn of the skin.
Okay, well, it's all very encouraging that there are things that you can do to look younger, and it doesn't have to be an injection, and not permanent things, and there's an argument to be made for more more lasting surgery, but maybe not everyone wants to do that or can't do that or just wants to do something smaller. So very good that we have options, and thank you so much for explaining them to us. And don't go away, Manjula, because we want to talk to you about different environmental rashes. So everybody stick with us. More with Dr. Manjula Jegasothy in just a minute. This is Health Check with Heidi Godman on WSRQ.
These are the days that I've been missing.
Welcome back to Health Check. I'm Heidi Godman. If you're just joining us, my guest today is Dr. Manjula Jegasothy. She's a Harvard and Yale-trained aesthetic dermatologist, founder of Miami Skin Institute, and we've been having a lot of fun talking to her about the new Botox, which is really these new skin tightening and lifting lasers. But we want to switch gears now for a minute and talk to her about rashes, because you can get rashes from all different kinds of things, allergic reactions to makeup and things like that. But we want to talk now about the environment. And Manjula, in Florida, just hives seem to be a chronic thing with a lot of people.
Yes. What people don't realize is when they suddenly start scratching or when they scratch and get a welt from it, all of that is really just hives. I don't think that most people even understand what hives are. And what it is a raised area of redness that's intensely itchy. It can be in the form of a circle or in the form of a straight line, and it can occur anywhere on the body. Mm-hmm. And it comes up all of a sudden, and so everybody is like, I didn't do anything different, I didn't eat anything different, but all of a sudden I have this. And in Florida, we all know, the construction business is booming, and I think one of the most common allergens that causes hives in Florida is construction dust. And certainly if you live in an area that has a lot of air pollution, that's the same concept. It's an inhaled allergen that's sort of a chemical or industrial allergen that then gets internally causes the hives. Hives is caused from histamine in the blood. So essentially an antihistamine tablet is the way to treat it.
All right. Now, I've never gotten hives, so I don't even know how they feel. Do they itch?
They itch terribly. That's the hallmark of a hive, is that lots of other rashes don't itch. They burn, they might hurt, they might feel warm, but they don't itch as you just want to scratch your skin off with a hive.
Okay, well, hopefully you don't have to do that. So when do these present? I mean, do you wake up with them, or do you suddenly see them pop out of your skin? What happens?
Yes, they occur. You can either wake up with it one day, or it can just occur generally in the course of an hour or two. If it's taking weeks to months to evolve, then it's not hives. Hives evolve within the course of a few hours.
Okay, all right. So it's a sudden appearance and marked by extreme itchiness. Mm-hmm. And what do you do when you see it?
So, again, that's what you think you have. If you have no allergies to any medicines that you know of, there is no harm for you to go to the drugstore and buy Claritin or Allegra or Zyrtec. Zyrtec is my preferred anti-hive medication. And just take a tablet, and do not drive after taking one so that you know how drowsy it makes you. But other than that, just see whether that takes it away. Usually, if you catch the hive within the first hour or two of getting it, 1 or 2 treatments with the tablets will take it away completely.
Okay, but not everybody should take an antihistamine. I mean, let's talk
Correct.
about that too, especially we have so many older adults listening right now.
Exactly. So one thing very important, do not take an antihistamine if you have to drive home from the drugstore. Wait until you go home to take the antihistamine.
And why is that?
Because lots of them make people extremely drowsy, and it can hit you unpredictably, depending on how much food you've eaten that day or a bunch of other factors, how big you are, how much you weigh, etc. So it's a good idea to be home when you take it and be able to sleep if you need to after taking it for, a good few hours.
Okay, so go to the drugstore and get an antihistamine and go home and then take it.
Correct.
And how long should you expect that you'll have these things? I mean, will they go away pretty quickly if you take the antihistamine?
Yes, but as I said, if you take it within an hour or two of getting the rash, you should expect for it to go away after taking 1 or 2 doses as directed on the bottle of the antihistamine. Now, you were saying also about mature individuals. If you're on a lot of other medications, it would be a good idea for you to call your primary care doctor and ask if you can take an antihistamine.
Yeah, because it's an anticholinergic, right?
Correct. And if you're on some blood pressure medications, or even if you're on certain pills to sleep, it can interfere with them. So make sure you ask. Because certainly, while really annoying and scratchy and a nuisance, hives are not life-threatening unless, it's something that where it's impacting your breathing or something like that. And then that's a serious allergic reaction for which you have to go to the hospital. We're just talking strictly the rash.
And then they go away pretty quickly. Do they ever last for a long time? And then what do you do?
Occasionally they can. If the rash has come and gone for a person for more than 6 months, then we call that a chronic hive. The medical term for hive is urticaria. So if you see on the TV shows, on the commercials, it's called urticaria. And so if they have it for more than 6 months, then you should see a medical dermatologist who will check your thyroid and check your liver, because occasionally certain conditions of the liver and of the thyroid can cause you to get chronic hives.
Okay, and we've used up the whole segment talking about hives because I keep asking you about them. So, and it's very interesting, but we should also say that you can get rashes from seasonal allergies and things like that too. And we only have like 10 seconds to talk about that. So let's just not even talk about it. You can get rashes from allergies. If you do, talk to your dermatologist.
And in Florida, it's in the fall rather than the spring.
Okay, good point. All right, we're going to take a quick break for news and weather. When we come back, we will talk about skincare for every age for women. So if you're in your 20s, your 30s, your 40s, your 50s, and beyond, what should you be doing right now? We'll find out. This is Health Check with Heidi Godman on WSRQ. Talk to you in a minute. Welcome back to Health Check. I'm Heidi Godman. We are talking today with Dr. Manjula Jegasothy. She's a Harvard and Yale-trained aesthetic dermatologist, founder of the Miami Skin Institute, and just a lot of fun to chat with about the things that we have to deal with every day, wrinkles and rashes. And now we're going to talk about skincare. So skincare changes over the years. The needs that you're going to have will be different when you're in your middle age compared to early age, compared to very old age. So Manjula is going to break it all down for us and tell us what we need to do. And Manjula, I think when you're in your 20s, that's when you should be the most vigilant. And wouldn't you know, that's probably when you're the most careless.
Correct. When you're in your 20s, you think that you aren't going to age and you're always going to look this pretty and your skin is always going to be this nice. But this is the time that you should start with the right skincare habits. And I'm sure everyone has heard this 100 times, but it always starts with sunscreen.
It does. It does. And tell us about the real damage you can do to your skin in your 20s that doesn't show up until much later. And I especially want to bring in our producer, Bridget O'Brien. Bridget is absolutely stunning, gorgeous skin, gorgeous girl, and beautiful, brilliant, amazing. Has just such beautiful skin, and you're in your 20s. So, I mean, let's get your take on this, Bridge. What do you think about, I'm going to look great forever? What do you think? I'm putting you on the spot. You didn't know.
I guess I'm looking at things that, moisturizing is suddenly starting to be important to me. I'm starting to look at those things a little bit more seriously, but I'll admit I haven't been vigilant.
No, and you can't imagine it. And I remember in my 20s as a young reporter talking to older women who would be getting different treatments and thinking, that's a million years away. Is that how you feel about it?
Yeah, pretty much.
Okay, we're going to meet back here in a few years, and then we'll talk. So, okay, all right.
Sounds good.
All right, well, you are just so beautiful. Your skin just glows. So, all right, so let's talk about what you should do in your 20s. And Manjula, you said...
And Heidi, what you just said to Bridget is so true about her skin glowing.
Yeah.
That's the thing. In your 20s, your skin glows. You can't imagine that, it's going to be any different. And what really does change as you get older, and especially if you did not protect against the sun on a daily basis, or definitely at least when you had a day at the beach or a day out on the boat or a sustained sun exposure, is that your skin stops glowing. And the main reason for that is that we do not exfoliate our dead skin cells as well in our 30s, 40s, and 50s as we do in our 20s. In your 20s, you can go to bed with your makeup on. You don't have to wash your face every day, even other than in the shower, and your skin exfoliates itself by itself. As we get older, it doesn't do that, and so we need the skincare products to help it do that.
Okay, so 20s, you should be wearing a good sunscreen. Should you moisturize?
You should moisturize if you have areas that are dry. You don't necessarily need to moisturize everywhere on your face because that can clog your pores and give you acne. So in your 20s in general, I tell my patients definitely a good eye cream that has some growth factors or peptides. That's kind of the trendy and scientifically proven thing for eye cream nowadays. And then use that same product around the area around your lips, because that's another area that tends to become quickly aged if not treated properly in the 20s.
Okay, all right. Let's move on to the 30s. What should we be thinking about?
So now with the 30s, you're going to start to see your pores get a little larger. You're going to start to see fine lines. Perhaps you don't need Botox yet, but you definitely need to exfoliate a little bit better with skincare. So then we come to the salicylic and or glycolic acid cleansers. In your 30s, everybody should be doing that eye cream they had in their 20s, maybe something a little stronger also with a little vitamin C in the eye cream or in the face cream in the areas that need moisture, and then also please use an exfoliant like a glycolic acid to cleanse, and also maybe with a toner to remove makeup.
Okay, and what are the challenges that we'll experience in our 30s?
I think the big thing in the 30s is that fine lines start to show, and so you need to really be on top of using anti-aging skincare and not just drugstore brands that, the drugstore brands have become a lot more sophisticated lately. They do have retinol, they do have vitamin C. However, they don't have studies behind them to show that these products actually penetrate the skin, that the active ingredients actually penetrate the skin and that they actually work. If you buy products that from a physician's office, generally they tend to have studies behind them that prove efficacy and penetration, and so that would be the way to go. It's worth it to pay just a little bit extra to get a product that you know is going to be something that works rather than essentially just putting expensive vitamins on the surface of your skin.
Okay, so then how often would you be using these products? Is that an everyday thing?
Daily, yes. Daily is best. If you can't do it daily, at least maybe try weekdays, and you can take breaks on the weekends. But again, please don't forget your sunscreen on the weekends.
Now, the 30s seems to be a decade when so many women are having children. And tell us how the hormones affect skin in the 30s, especially if you are having children.
Absolutely. It used to be this old adage that if you were having a boy is when you were going to have the most acne, but I'm not really seeing that anymore. I'd say that it's about equal. If you're having a boy or a girl, about 50% of women tend to break out and get a lot more acne during pregnancy than other times. So you need to change your regimen to include anti-acne products, of which I think the most safe during pregnancy is probably benzoyl peroxide. The main thing during pregnancy you need to avoid is anything containing retin A, retinol, retinaldehyde, all of those things, because even though they haven't been proven to go into the blood or to affect the placenta or the baby, it's known that those products, if taken orally, do affect developing fetus. So it's not a good idea to do skincare that has any retinols in it while pregnant.
All right, but then let's say you have the baby and then you start using those products again with retinol, Retin-A, any of those.
After breastfeeding?
Yeah, after breastfeeding. Very good point. But what, it's on your fingers, it's on your face, and then if the baby rubs against your face or anything, is there any risk to the child?
So you wash your hands, so that takes away the issue of it being on your fingers. And then, and moms in general, when you have babies, it's so important to wash your hands much more than you think you need to. Even if you think you're not doing anything, wash your hands every hour anyway. It's much safer. And then in terms of the baby touching your face, if you put the product on and let it dry completely, which takes usually between 5 and 10 minutes before you pick up the baby, if you can, then that's the best way to alleviate or eliminate that possibility as well.
Mm-hmm. But again, this is a decade where you could still be doing quite a bit of damage to your face because of the sun.
Yes, and I think new moms are probably the guiltiest because they're so busy and it's so hard to remember. You're sunscreening your baby and to sunscreen yourself at the same time.
Yeah, boy, I had 3 babies in my 30s, so I'm right there with you. Okay, all right. Well, very, very interesting, and we want to find out what about the 40s, the 50s, the 60s, because things start to change. But we are going to take a quick break, so everybody stick around. When we come back, we'll keep speaking with Dr. Manjula Jegasothy about this and find out what you need to do and what the options are. This is Health Check with Heidi Godman on WSRQ. We'll be right back. Welcome back to Health Check. I'm Heidi Godman. We have just been having the best time this hour talking with Dr. Manjula Jegasothy. She's a Harvard and Yale-trained aesthetic dermatologist, founder of the Miami Skin Institute, and she's been spending this whole hour with us, giving us her dermatology secrets, if you will, of what we can do to stay looking our best, to look our best, but also to have very healthy skin. And we've been talking in the last few minutes about what to do at each time of your life, in your 20s, your 30s. Now we want to talk about the 40s and beyond because things really start to change. And Manjula says this is really broken down into 2 categories, premenopausal and postmenopausal. So Manjula, tell us about those premenopausal years.
Sure. So in your 40s and 50s before menopause, and I know everybody sort of comes to menopause at a slightly different age, so that's why it's most important not to break down this age group, or the skin type by age, but by whether your hormones are menopausal or non-menopausal. So before menopause, again, it's more of the same that we discussed in our 20s and 30s. We don't exfoliate as well, so now you need to use a glycolic cleanser every day religiously. You'll notice your eyelid skin and the delicate skin around your mouth starts to become more wrinkled, and if you choose to do Botox or not to do Botox, now is the time to get some really good growth factor eye creams and moisturizers on board. And then the other thing is for brown spots, there are decent bleaching creams, but as prevention, vitamin C is proving to be a really wonderful topical agent for bleaching out those brown spots that might have come out from small mistakes you made in not applying the sunscreen in your 20s. I tell all of my patients that every single blister or every sunburn that they got that was really bad in a given area is going to turn out to be a nasty brown spot in 20 years. Ooh. And it gets them really to change their behavior. I've seen it in friends of mine, girlfriends I've had since I was 20. We'd go on spring break for college, and one of them would get a blistering sunburn on their cheek, and now I see them at our reunions 20 years later, and they have a keratosis or a brown spot in that exact place. And I'm like, I can trace the background of that particular age spot. It's
right? Yeah, so, but you can take care of those things, right?
Yes, you can take care of those things in the office, but you can also prevent those things if you start using vitamin C serum, and one that's proven. Some of the best brands for vitamin C serums are obviously SkinCeuticals, people have heard of, the Obagi skin products. A lot of them have proven vitamin C penetration, and that's what you need to prevent those kinds of brown sunspots. So that's what you need to start using premenopausally in your 40s and 50s. And then the other thing you need to add, everybody needs a retinol or retinoid night cream in your 40s and 50s. That will do two things. It'll close your pores, and it'll help with the fine lines, even if you don't get an in-office procedure.
All right. Does it have to be a night cream, or can you wear it all the time, or what?
It's better if it's done at night, just because in some people it can make you sensitive to the sun. If you find that you're able to put it on and go out in the sun and not become sensitive, meaning having a burning, tingling reaction from sun exposure, then you could do it any time. But not most people, about half people get a little bit of sensitivity to the sun after applying retinol, so that's why we recommend it at night.
All right, so I want to go over these things again. You said a soy-based moisturizer?
So soy-based moisturizer comes later. That's when you're postmenopausal.
Okay, all right, sorry. So growth factor eye cream.
Growth factor eye cream. And then there's a lot of those that are available mostly through doctors' offices. The eye creams that are available over the counter really don't have great studies proving penetration. I know people like them, but I prefer the physician-dispensed brands like Neocutis and Biopel. They all have studies behind them. So a growth factor eye cream in the eye area and around the mouth, vitamin C serum, such as Obagi or SkinCeuticals, over the whole face in the morning. Cleanse with a glycolic cleanser and toner, morning and evening if your face can tolerate it, otherwise just once a day. And then a retinol or retinaldehyde or retin-A cream at night.
Okay. All right. So that's for the premenopausal years. And
yes.
there are only a few of those. I mean, maybe a decade or 15 years at most. So then you make the change, you cross over, and then you are dealing with a whole new ball game when it comes to your skin, mostly because of the lack of estrogen. Tell us about that.
Correct. It's so funny because the rest of medicine is all concentrating on the lack of estrogen in the rest of the body, and what it does wreaks havoc, as everybody knows, the hot flashes and all the other things. But you lose significant amounts of estrogen in the skin as well, and the only way to supplement that is to not by taking estrogen orally. It hasn't been shown to elevate skin levels of estrogen or to even apply those estrogen hormone creams. The only way to do it is to apply a soy-based moisturizer to the skin itself. And that's been shown in studies and proven that it increases skin estrogen levels. And that is the single biggest difference between premenopausal and postmenopausal skin. So if you use a soy-based moisturizer twice a day, you are going to keep your skin looking as good as it did premenopausally.
All right. Where do you find a soy-based moisturizer?
It's interesting. Aveeno used to have a really wonderful line of them about 2 or 3 years ago, and they just discontinued it from what I'm reading. But I'm seeing that some of the other Olay brands and some of the Neutrogena brands have some soy moisturizers in limited areas. Otherwise, I know that most dermatologist offices carry soy-based moisturizers. And again, it needs to be a soy that can penetrate the skin. So it might be a good idea to go and see a dermatologist to get a proven penetration. Another place that I find is a lovely way to get effective and scientifically proven skincare are on doctor-owned websites, and I have no interest in any of them, financial interest, but there's one called lovelyskin.com, for example, that sells all of the products I'm talking about that have been actually scientifically proven. And they have a wonderful range of soy products, and it's really no more expensive than going to the drugstore.
Okay, very interesting. Thanks for the tip. Okay, so if you're postmenopausal, you want to apply a soy-based moisturizer twice a day. What else?
So soy-based moisturizer twice a day, that is your principal moisturizer at this point. If you find that you are still having what I call the hallmarks of postmenopausal skin, which is dull, dry, and flaking, then you need to also employ a glycolic face cream. So you're not only washing with glycolic acid and toning with glycolic acid, now you're using it immediately afterward as your face cream also, because you simply just need more exfoliation. So you're basically piling on the skin creams in the postmenopausal phase, in the hopefully 30 years that you have when you're postmenopausal. You're doing a cleanser, and then you're doing 2 different skin creams, morning and night. And then I would love it if you could to do a retinol cream over all your lines and areas that have sun damage.
Now, can you really pile on all the creams? I mean, if you put on one and then you put another on top of that, do they all just sort of get mixed in together, or does it matter?
Well, actually, they all attach to different receptors on the skin. That's the big thing about scientific skincare now, is that they have proven receptors they attach to. We know exactly what they're doing. We know exactly what they're doing to the skin cells themselves. The goal is with all of this skincare is to build collagen and to close pores. So all of these things will build collagen, and then the other one is to exfoliate the dead skin. So we know that at the cellular level, these products are doing these things. And applying them at the same time is not a problem because they go and attach to different receptors.
This is great advice, and you just saved us so many minutes in the waiting room and in a doctor's office, and also money, because this is great advice. Thank you so much for this wonderful insight. And
Sure.
how long then do you have to keep it up? I mean, this is a thing you've got to do every single day for the rest of your life.
I've been doing it every single day since I was in my late teens, early 20s. Yeah, it's part of if you want to keep your skin looking as good as possible. And lots of women are interested in looking as pretty or as beautiful as they can into their 90s. So yes, you would maintain it every day. If you shower every day, if you do all, this should be part of self-care.
Okay. All right. Well, that's good advice. And if we want to know more about you and what you do, how do we find that out?
You can find me on the web at miamiskininstitute.com. And then I was thinking, I have a wonderful Pinterest board. If anybody is on Pinterest.com, just search Miami Skin Institute, and I have very specific explanations of all of these ingredients and all of the actual skincare products that contain these ingredients that have the scientific studies behind them. So if you are interested in buying something online, you can take a look at what I say about it on my Pinterest board.
Oh, that's great. I really like that. And if there's one thing that we could all do, no matter what our age is, and go home and do it tonight, what would you recommend that is?
If the one thing, it's a glycolic acid wash.
Really?
Mm-hmm.
All right. Very, very interesting. And you can just get that in the drugstore?
That's, widely available. Neutrogena makes a really nice one. It's called AHA BHA cleanser.
And that'll give you that nice glow?
Yes.
Does it take time before you see it?
You'll see it within a week.
Oh, okay. I'm going to go do that. Thank you. I've been writing down everything you're saying. I'm going to try some of this stuff. This is really great. Thank you so much. So much fun to talk to you.
You too, Heidi. Thank you so much again.
Thank you. Okay, everybody. Again, if you'd like to find out more about Dr. Manjula Jegasothy and what she does, again, she's a Harvard and Yale trained aesthetic dermatologist. She's in Miami. She founded the Miami Skin Institute. She has a Pinterest board, and it's Miami Skin Institute. Just go on Pinterest and search it. Or you can just go to her website, miamiskininstitute.com. That'll do it for us. I think Bridget and I both learned something today. She's shaking her head yes. And we will talk to you again tomorrow. I'm Heidi Godman, and you've been listening to Health Check with Heidi Godman on WSRQ. Hope you have a wonderful afternoon, and we'll be back. Bye-bye.